Hi, I'm Joe Feeks, editor of Pig Health Today, and with me is Montserrat Torremorell. She is an associate professor at the University of Minnesota. Thanks so much for joining us, Montserrat.
Thank you.
And congratulations on another successful Lehman conference.
No, I appreciate it. Thank you. No, it's fun.
Now, I know that you weren't presenting specifically on swine influenza, but you said many of your students were. This is a disease that the pork industry has been battling for as long as I can remember. What is new with swine influenza? What are you learning about adjusting to the different strains and vaccinating and managing it appropriately?
Yeah, so some of the things that we are learning, I mean, my group has been focused on research and try to understand some of those questions, specifically about what happens at the farm level in terms of understanding influenza per se, the strains that might be co-circulating in a farm. We have very little information on that. We've also been doing work to understand the overall epidemiology, the dynamic of the disease, and then, of course, with the goal to have better protocols to control it and eliminate it. So that's our goal, to have, at the end of the day, you know, like what we do for PRRS nowadays, that if we have an infection, almost everybody knows what they're supposed to do. So we would like to get to that point with influenza. But before we can do that, we are trying to do quite a bit of the research to understand, in particular, transmission, so that we get to that point. So some of the things we are learning, we continue to be astonished when we do sampling and we look for different viruses. Depending on the methods we use for looking for the virus, it's impressive the amount of viruses that maybe you may be co-circulating in a farm and that you didn't know. Just because on a day-to-day basis, nobody will do that level of intensive testing that sometimes... The number of
flu viruses specifically that you're saying?
Okay. So it's easy often in a given farm. I mean, it's not like it's an indefinite number, but it's certainly more than one. So
typically, what would you see on a Minnesota swine farm? If you go out, you test it for influenza.
Yeah, so all the studies that we've done, in many of studies that we've done, and some of the sampling, so we have data in a given time, but also when we look at it over time, let's say between 6 to 12 months, easily you find 3 very distinct viruses, okay, in that time period. So that's actually, I would say, very, very common.
What is it about flu that makes it evolve and change so much?
Well, I mean, we know how flu virus changes, right? That the fact that it's an RNA virus, the fact that it's has a segmented genome, and then it can reassort. That's a traditional answer, right? And we know those are things that facilitate the change of the virus. However, the way how I look at it from the pig side of things, I believe that things that facilitate to have those many viruses, it has to do more with maybe how we raise the pigs in terms of, again, our farms are in high dense areas, so more likelihood of getting infected if there is regional spread. The fact that, unfortunately, influenza in people, it's not always very well controlled. But what I mean by that is that the seasonal vaccines that we use in people may not always be very effective depending on the season. So, and there is some speculation that when that agreement is not very good of the vaccine in people, then of course if you get sick as an employee, there is more likelihood that you would be shedding virus, and then again the likelihood of infecting the pigs. And I think there is truth to that in the sense that a lot of the research shows that the viruses that we have in pigs, many of them, not all of them, but many of them are of human origin. So I think when it comes down to the pigs, and the pig itself as an individual just likes to reassort. I mean, the pig has, you know, he's very generous, you know, in the sense that it welcomes all different type of viruses, and then the viruses love it, and then so there are all these different pieces that they just come together besides the characteristics of the virus itself. The other thing that happens in farms, and we've done quite a bit of research in sow farms, you have, it's very interesting because you have a population of animals, the piglets, when they are born, that they are born without virus. Okay, so this is not like the PRRS virus that can cross the placenta. Here, the piglets get infected after birth. And then basically the infection happens in that second week of age. Okay, and then the most viruses, if you want to look for them, it's right prior to weaning. So something is happening from a management perspective and so on that really facilitates those viruses to take off. Of course, even if they have immunity, that's passive immunity, so it starts to wane a little bit. So that facilitates, but there might be things we do at the management of the far-wing rooms in particular that I'm convinced facilitates the virus to persist. So this year in particular, one of my students will show some data in terms of doing surveillance in far-wing rooms in particular. We also have documented the role of the sow, the skin of the sow, to be a very good source of virus. So if you really think in terms of cross-fostering and so on, that's another way of how you can maintain the virus in those populations.
Is there anything we can learn from our management of PRRS and other viruses that can be applied to swine influenza? Or is this virus that unique where it really requires special attention?
Well, it's one of those things that I'm sure 80% of the things apply basically to all the viruses, you know, what we talk about. Cross-fostering, for example. There are certain things that apply to 80% of the viruses, or 80% of what we do would apply to any of those viruses. But then depending on the virus, there is that 20% that it needs to really be specific for each virus, like PED, for example. The fact that it's an enteric virus, so you would do something different than if it's PRRS. PRRS, you have to look more at the transmission via blood or the transplacental transmission. In the case of influenza, the aerosol, this observation that we are seeing about the potential role of the sow to transmit the virus, I think that can be a big deal, that we just haven't looked at it for other viruses. Again, the influenza gets shed in a lot of quantity in the mouth and in the nose of the piglets, and the same might not be true to that level for other viruses. So there will be things that we can learn from and apply and will be helpful. And it's like a whole package. It's like you cannot just do one thing. You have to do the whole package to really see the benefit.
What is the primary source for swine influenza getting into the swine herd? Is it people?
Well, people, it's, we think of people when we see some of these human origin viruses, the seasonal, but the pig is still, so people, it's a good source of introducing virus, okay? But the pigs is still the one that replicates, and in my view is still the main source of dissemination of the virus. So you have to think in terms of the gills, the replacement animals that you purchase from other sources, that for any disease, always it's your first one that you want to rule out to a certain degree. So the same would be true for influenza. And then when you wean the animal, again, the pigs that you're sending to your nurseries or to your wean to finish, those are, I would say, the main sources. And there is always the, and for many diseases, there is this association that depending on where you're located, you have a higher chance of being positive, right? Your neighbors, the density of the place or the facilities around you, that's also important.
Now, in the pork industry, some people have had success eliminating PRRS. We just talked to Paul Yeske. He's talked to us about eliminating mycoplasma. Is it realistic to think that we could eliminate swine flu?
You know, there has been some attempts to do that, and Dr. Bob Thompson, who is the Science in Practice award recipient, he's done it, and I think there is some success to that, and I think there is some value to that. But again, the fact that we don't always understand how the viruses get introduced, sometimes that success of elimination is short term, but not different than for PRRS when we started with elimination, right? At the beginning, I mean, you can eliminate it, but the issue is the reinfection. So with influenza, we are still 10 years too early, compared to what we know for PRRS. So I think we will get there. I think it's still too early. for influenza to really be able to say, yep, we have to go and eliminate it. I don't think we have all the information. And we have different tools. I mean, vaccination for influenza, we've done quite a bit of work vaccinating where we look at the effect of vaccination in sows and then the effect of affecting prevalence at weaning. It does, vaccination, when you do that, you have less animals being weaned influenza positive. So there are tools there that, again, if you use those tools in combination with some of these management practices, maybe increases your chances, maybe not to be negative, but to control it at least, or to give the pig a better chance to get started.
What have we learned about vaccination, though, in terms of, timing and to the extent of, that sow herds and grow finisher herds should be vaccinated?
Yeah, that's a very, very good question. I mean, we continue to learn, I would say. I don't think, again, we have all the answers. A lot of the work, and it depends on the systems, but a lot of the work is being using inactivated vaccines because they are the ones that are available commercially. And then again, with the goal to protect the piglet, okay? But the piglet, because you're weaning a pig that is 21 days of age, the only way to actually protect the piglet is if you vaccinate the sow, right? So that's been the traditional approach to control influenza. And we've seen that things that we've learned in our end, both pre-farrowing vaccination and mass vaccination, those are both protocols that are valid to decrease prevalence at weaning compared to no vaccination. So I think that's good information there, but more needs to be done. In regards to the vaccinating the pigs, the question on the interference with maternal antibodies, that's always a big question. And there is a lot of variability in terms of the type of antibodies the pigs have. I think that's the part that we don't understand very well.
What about the seasonality of swine flu? Have you been able to find a distinctive pattern?
That's right, actually. Yeah, we've looked at data from farms in the Midwest for the last 5 years. We had data, we were working with a production system that they had a very nice monitoring system. And we do see a seasonality pattern. And at least in the area here in the Midwest, it's, we see it. Obviously, the lowest month would be the summer, as expected. But then we see in the fall starting to go up. But the peak months would be December. But what was surprising to me is that we also see a second peak of infection in the spring. Okay, late in this data set, at least, was late spring. So to me, that was surprising because I always think in terms of the fall or the winter. I just don't think in terms of the spring. And that just tells me that influenza is important year around, even in the summer. I mean, we know we have plenty of information that it shows that even in the summer, the farms still remain positive. If it's like they are positive, but maybe there is not as much viruses, but the viruses are still there. So that's also very interesting to me in terms of the seasonality and the presentation and how you should plan your control strategy for influenza.
Well, I'm sure the pork industry appreciates all the attention that you're giving this rather elusive disease.
Yeah, no, appreciate it. Yeah, many questions I think we still have to try to address. So.
We've been talking to Montserrat Torremorell. She is an associate professor from the University of Minnesota. Thank you so much, Montserrat.
Thank you.